In this clinical laser video, we're going to be demonstrating how the precise SHP laser can be also used for whitening teeth. Now, like any other whitening procedure, be realistic about how you use your laser and what type of result you want. I think lasers really help in whitening teeth in an in-office setting, and I've gotten some really nice results. In this case, we're going to be utilizing the laser just like we would in other in-office whitening techniques. We'll have to block out using a light-cured blockout agent. It's a nice blue shade, so it has a lot of contrast from the teeth and gums. We've also used a dam to isolate the lips and some of the mucosal tissues, just as a precaution to help isolate the teeth when we are applying the whitening gel, which is a strong hydrogen peroxide concentration. Now, like in-office whitening or laser in-office whitening, the laser is actually going to be used to initiate or energize the hydrogen peroxide to penetrate into the teeth. Now, lasers or diode lasers seek pigment. I just associate pigment with stain or dinginess to the teeth. If we can place a hydrogen peroxide gel on the teeth and the laser activates that gel and penetrates that gel into the teeth to remove the pigment or staining, it just makes sense that we'll get a nice result. So here we're going to use the Ascent PX curing light. It's a nice little product the CAO group produces. We're going to use that to light cure the blockout material, isolating the gingival tissues. So just go over maybe 20-30 seconds, and that should be adequate to set up the blockout material. Once we're done with the maxillary arch, then we'll start on the mandibular arch. How far do you go back? Look at the patient's smile. In this case, we're really just going back to the first premolars. Usually I just go back to the first premolars. If the patient has a very wide smile, open smile, you can go back a little further, maybe the second premolar, but that's really as far as I extend the blockout and as far as I'll extend the whitening. So here we're just applying it to the mandibular arch, again hitting it with the Ascent PX curing light. You get that set up. Try to maintain a nice dry field. And then we'll apply the hydrogen peroxide. In this case, the whitening gel is a 30% hydrogen peroxide solution. So I just use a straight tip. I'm going to put a drop on each of the teeth. Once I get a drop on each of the teeth, then I'm going to switch to a little brush, and I'm going to actually brush and spread the hydrogen peroxide gel around with the brush. I just find you have a little better control, and it tends to get it in all aspects or all parts of the tooth. So here we are, we're just spreading that around, working it into the tooth just a little bit. Once we get the gel in place, we'll then look at our laser. We have a setting of 3 watts continuous. So we have 3 watts continuous power. There's a special handpiece that adapts to the SHP precise laser, and the tip of that handpiece is going to spread the laser energy out. Now that tip is disposable, so if you do touch the tooth a little bit or get a little gel on it, don't worry, that's going to be a disposable part of the whitening procedure. Here we're going through each quadrant. We're applying the laser energy for 1 minute per quadrant. Okay, so we're doing 1 minute per quadrant, 4 quadrants, that's a total of 4 minutes. Once we complete that 4 minutes, we're going to then allow the gel to remain on the teeth for about 11 minutes more, creating a cycle of 15 minutes to complete the first phase of the whitening. So here we're just finishing up the 4th quadrant. Once we do that, we're going to leave the gel on the teeth. I like to go back and utilize a little brush and actually spread the gel out one more time as we're doing that, as it's shown here, just to make sure it's covering and it's interacting with the whole tooth surface. We then leave that on for 11 minutes. After that's been on for 11 minutes, a total cycle of 15 minutes will suction that off. At that point, we will reapply the gel and go through one more cycle of 1 minute per quadrant for a total of 4 minutes, and then leaving the gel in place for another 11 minutes. So total whitening time is 30 minutes. We then rinse it off, clean that up real nice, lots of water because it is a hydrogen peroxide based gel. Once we get that all done, we then will peel off the blockout material. And in this case, we started with about a B3 shade, and we'll look in just a second and see what kind of result we get. But I can see already that we've gotten a little whitening. It's lightened the teeth up, so the gums look fine. There's no real irritation to the gums, and we're to a B1. So that's a pretty nice result for an in-office half-hour laser procedure.